I'm Jamie Boswell. I'm a physical therapist here at UCSF Benioff Children's Hospital, Oakland. And I am currently at the Walnut Creek campus, and we're in the Sports Medicine Center, the Motion Analysis Lab. So a little information on the Walnut Creek campus. We have a lot of different sections to our clinic here, and it includes ortho, a sleep laboratory, a lot of subspecialty clinics here. So it's not only the Sports Medicine Center for Young Athletes. Some visuals of the different areas of the hospital we have here, and a little bit about our Sports Medicine Center for Young Athletes. We have comprehensive rehab of all sports injuries, physical therapy, sports training, athlete development program, and risk injury assessments. Lots of great things going on here. Let's get into our webinar objectives for today. So the first thing we want to do is understand common injuries associated with mountain biking. We want to learn ways to stay strong and maintain our bodies both on and off the bike. We're going to discuss and practice some stretches, exercises, and drills to improve our biking efficiency. And then I'm going to give you guys some bike safety tips, information on how you as an older, teenage biker, and then parents, what are you guys looking for to keep your kids safe as well. So let's first talk about the different kinds of bikes. So for people that are new to mountain biking, there are two kinds of bikes. Actually, there's a lot of kinds of bikes, but we're going to kind of narrow it into two different types. One is the mountain bike, and that's the bike, so it would be viewers left, the black and blue bike. And the bike pictured there, it has both front and rear suspension, and that's what's going to set it apart from a road bike. Now, not all mountain bikes have full suspension, but typically a normal mountain bike will have at least front suspension to take away, to help absorb some of the shock. You're not riding on flat roads anymore. You're riding on mountains and dirt and rocks and trees and roots, and so you need that suspension. In comparison to the road bike on the right, you have the curved front handles, there's no suspension whatsoever, and a little bit more rigid frame. A little bit difference in the position of when you're biking as well. The mountain bike, you're a lot more upright, your back is more erect, and compared to road biking, where your hands are way farther over on the handlebars, your back is going to be a little bit more forward flexed just to reach. And on a road bike, you can also go down into what's called the drops. So you can drop down and ride in a little more aerodynamic position, which you can achieve a more aerodynamic position on the mountain bike, but it comes more from like where your hips are. A little bit on the types of mountain biking. So it's become a very more well-known sport. And in fact, the sport of mountain biking was introduced into the Olympics in 1996 because it became so popular. In mountain biking, there is cross-country mountain biking, kind of that like all across a mountain, like more endurance. Most people around here would do probably cross-country mountain biking because there's not a whole lot of single-track trails, at least in the East Bay. I know there are more single-track over in Marin. Trail riding, that would be what you would find in Marin. All mountain enduro, so it has a wide variety. You can do a little bit of everything, both downhill and trail. Downhill is specifically going straight downhill pretty much with a lot of more technical elements to it. Typically people will either grind it out and ride the double track up or the Jeep trails up to the top and then barrel down, or at a lot of ski resorts people will take the gondola up and ride down that way. There are more specific types of bikes for the downhill. They have a lot more shock absorption. Free ride is exactly what it sounds like. Free riding over jumps, different types of terrain. It's kind of patterned after snowboarding where, they go in the terrain park and they kind of do whatever they want. Free riding is the same way. You can go and jump things or, be as free as you want when you're free riding. And then dirt jumping is specifically jumping over like dirt built up jumps and ramps. And then those are a lot more technical aspects of mountain biking, which I will not really get into today. That would be when you may want to venture and find like a specific mountain biking coach or a team to go with more than just going out and trying mountain biking on your own. So a lot of parents wonder, is my child on the right size bike? And starting out, if your kid has a mountain bike already, the first thing you should do is see if your child can stand over their bike. If they can't and the bike is too high for them, they can't actually get their legs over their bike, then it's too big. Child bike sizes are determined by the diameter of the wheel. Kids' wheel size range from 12 to 24 inches. Then once you get into the 26-inch wheel size, that is an adult-sized bike. Typically, kids aged 9 to 14 can transition to an adult bike, but it really is dependent on the kid's weight, height, and their confidence and skill levels if they've been mountain biking before. In contrast, adult bikes are determined by the frame size, and then you will, I'd highly recommend going to a mountain bike store, like a bike store, and they can fit you for the right size bike. There are also male and female specific bikes, and it's the difference really is like the top tube, the height, the handlebar width. They're becoming very, very high-tech and savvy and creating really awesome, cool different bikes for both the female and the male genders. So let's talk a little bit about gear for safety. In this picture, this guy looks like, he's probably kind of crazy because he's all decked out. He's got all these pads and stuff on, but really, he's actually very safe. From the top down, he's wearing a helmet. Number one most important thing, make sure you're wearing a helmet. He's wearing sunglasses. The reason you should wear sunglasses, or at least some sort of eye protection, if you wear glasses, that's fine, because you don't want dirt or debris or a tree branch to hit you in the eye while you're out mountain biking. He's wearing closed-toed shoes. He has specific biking shoes on, but I think the most important thing is that you are wearing closed-toed shoes so that your toes don't get caught or you don't get your foot hit on something. He's wearing durable clothing. You can see he's wearing some long kind of pocketed mountain bike shorts. He's also wearing a jersey that has some pockets in it. And I will say you don't have to go out and buy the most fancy high-tech biking gear, but you need to wear something that's durable just in case you crash. You want to have some good solid shorts on, a shirt that can't easily be ripped by a tree branch or, falling on some rocks. He's also wearing gloves. Gloves are very important because when you're riding, your hands will get slippery and sweaty, and the last thing you want to do is lose your handhold and go over the front of your mountain bike or fall off because your hands are not, you don't have that stickiness from your gloves. He's also wearing elbow and knee pads, which these are optional, and initially when you start out mountain biking, I would recommend probably getting a set of elbow and knee pads just in case you crash. You might as well protect your elbows and your knees from the possibility of if you fall and you fall onto your knee, you could easily bruise up your knee or cut it open. So why not throw on some elbow and knee pads? They're becoming pretty lightweight these days, and so it's not too much extra to wear. So along with his clothing gear, you can also see he's wearing a camel pack for hydration. In a camel pack, he probably has in there, granola bar or banana or something to keep him fueled while he's out riding. And then he also should be carrying a pump on his bike, and then bike tools and a flat fix kit. Those are things that are super easy to pick up at a bike shop. If you're going to go buy a bike, you might as well spend another $20 to $30 and make sure that you have the tools necessary in case you get a flat or something happens to get you back to your car. And at that point, you can decide, what kind of flat kit you want, because there's a wide variety, but you need to have one on your bike in a bike pack, just in case something happens. Okay, we're good. Let's go move in a little bit to some injuries, because I feel like you guys should be educated on the injuries that can happen, and then we'll move into some fit tips, some safety, and some positioning stuff. So we'll talk quickly through a couple injuries that are common. Cuts, scrapes, and bruises are the most common. There's also the possibility of fractures, head injuries, overuse injuries, specifically of the knee and the back. But I will say, despite the injuries, mountain biking is a very worthwhile sport. In the picture, it's actually me and my husband when we went mountain biking in Moab, specifically Dead Horse State Park. And you can see in the background the views are stunning, and you can't get these views from a car. So, I encourage you to go out and ride But make sure you pick a trail you feel comfortable with, where you can go out and get some exercise while getting these views. All right, so a little bit into the dirty here. This girl looks like she crashed, although she's smiling, so it wasn't too bad of a crash. 60 to 75% of people report some sort of cut, scrape, or bruise. It's the most common injury reported. Injuries typically happen when your body comes into contact with a pedal, a handlebar, or some outside object when you crash. The risk of injury can easily be decreased by wearing the correct gear. So by wearing gloves, wearing knee pads, elbow pads, thick biking shorts, and tall socks. You never underestimate a good pair of tall socks to protect your shins from even your bike pedal flipping back up onto your shins. That can protect you really well. Let's move into fractures next. So most typical fracture is the wrist and hand. Unfortunately, it typically happens when you go end over end, as this guy in the picture where he flipped forward and crashed his bike. Typically it happens when people are attempting to stop a fall and they reach out with their outstretched arm as they're crashing their bike, and you hurt your wrist and your hand. So an option is some wrist and arm protection to protect or stabilize that wrist joint from either hyperextending backwards, or sometimes people do land with a forward flexed wrist. But I think the biggest thing, the take-home point from this, is to maintain control over your bike, both of the handlebars and your speed. Because if you are under control, the risk of crashing and fracturing something is significantly lower. So moving past that to some more like common sense risk reduction ideas for people that are at risk of getting a fracture. So fractures occur most often when riders are tired, when they lose focus on the trail, or they are overriding their limits. So you can ensure proper hydration, carry water and a snack. Always keep your eyes on the trail, stay focused, and check the trail type ahead of time just to ensure that you're capable of riding the trail. So we're going to move into a little bit more in-depth information about these topics now. Let's talk a little bit about nutrition and hydration. I know me as a rider, that's something that's super important for me, and over the years I've learned a lot about that, so I want to share some little tips and hints with you guys. Let's talk about dehydration first, because it increases the physiological strain on your body while performing exercise. Dehydration greater than 2% of your body weight degrades the aerobic exercise and your cognitive and mental performance ability in warm and hot environments. Typically in California, we're in a warm to hot environment. And so knowing these things ahead of time can reduce your risk of an injury. On the flip side of the coin, hyponatremia, or over drinking or consuming volumes greater than your sweat losses, can actually be more dangerous due to the extreme drop in sodium levels and the dilution. So let's talk about what you guys can do to get yourself ready for the ride. So before you even get on the bike, your goal is to prepare your body for this physical challenge. Slowly start to drink 16 ounces of water or electrolytes to get that sodium in your system 1 to 4 hours before your activity. Now, caffeine's been kind of a big question recently, but research has come out to say that caffeine can be consumed in small doses, so less than 180 milligrams, and will not increase urine output or cause dehydration. And one small cup of coffee is about 95 milligrams. So for our younger riders out there, I don't recommend drinking a lot of caffeine. For our older riders, if you want to use that as a little bit of boost, that's fine. The research shows that it's not going to decrease your performance. So during your ride, while you're out there, you're riding, and our goal is to prevent excessive dehydration. You want to replace 75% of what you lost during your ride. So kind of getting a little bit more in depth for my more advanced riders. This is measured by measuring your body weight before you get on the bike in the morning, and then right after you get off the bike, so that you can see the difference. And it should be within 5 to 15% of your total body weight. The goal is to consume between 6 and 12 ounces of a water or sports drink every hour, and this will really depend on your body weight and how much sweat you are losing. Sugar contains sodium, potassium, and carbohydrates. Heavier bikers need to consume more because they sweat at a higher rate. The goal is to take a drink every 15 to 20 minutes. So take about 5 or 6 sips every 15 to 20 minutes, kind of be watching your watch, kind of start paying attention to your intake, and make sure that you don't guzzle a bottle of water right before you get on the bike. Forget to drink the whole time and then chug a bottle of water at the end. That's about the exact opposite of what you would want to do. So the goal is keep hydrating a little bit throughout the ride. So you would want to consume, if you're talking about like, what do I eat while I'm out there? If I'm doing a ride that's an hour or longer, what should I do? You want to consume between 30 to 60 grams of carbohydrates per every hour of exercise. So your body can only consume 1 gram of carbohydrate per minute that you're out there exercising. So that really, take that into account how long you're out there, and look at the labels on your food and look at the carbs and kind of try to measure out how long you're out there. Good sources of carbohydrates are granola bar. Some people really like sports beans, so check into those and find something that you like that's easily consumable that won't upset your stomach. People like bananas because they also are high in potassium. The greatest carbohydrate delivery is achieved with a mix of sugars, but I caution parents out there because sugar is kind of the buzzword right now. Children should not consume more than 6 teaspoons or 30 grams of sugar per day. So let's talk a little bit more about that because a lot of sports drinks are super popular right now. Just a quick Google search of Gatorade brought me to this Gatorade Lemon Lime Thirst Quencher drink, which, it's very common. It's easy to stop and grab a Gatorade to go. But just a quick look at the label shows us that it contains 38 grams of carbs. Okay, so you got your 30 carbs, but it also contains 35 grams of sugar. So, if you have a granola bar and a whole Gatorade, you significantly exceeded the amount of carbohydrates and sugars that you need for a 1-hour ride. So my recommendation is to dilute down the sports drinks with water. Go half and half. Pour half the Gatorade into the water bottle and then dilute it down. So you're not getting as much carbs and sugars that your body does really not need. So the overall recommendation from the American College of Sports Medicine is that individuals should develop a customized fluid replacement program that prevents excessive dehydration. Remember again, that excessive dehydration is greater than 2% of your body weight from baseline, and you do that again by measuring yourself pre and post ride. The routine measurement of pre and post exercise body weights is useful for determining sweat rates and customizing your fluid replacement programs. Consumption of beverages containing electrolytes and carbs can help sustain fluid electrolyte balance and exercise performance. So for my athletes out there who are really getting into mountain biking, we should sit down and make an individualized program. If that's something that direction you're going, and you sit down with your coach or a nutritionist and figure out the right plan for you to optimize your success on the bike and in competition. So once you get off the bike, the goal is to fully replace any fluid or electrolyte deficit that you have. Replace with water or electrolyte drink. Now there's an asterisk by electrolyte drink because we just talked about, if you've already consumed 1 Gatorade, you've hit your carbs and your sugars that you need. So then you really want to start replacing the sweat you've lost and the fluids you've lost with straight water. That's the one sports drink that professional athletes don't endorse, just straight water. And it's very good for you. So you want to consume a beverage also that's 4-to-1 carb to protein, and a lot of times chocolate milk is a great option. Kids love chocolate milk. It's easy to get that protein back in your system as well. For my advanced athletes who are really competitive, you want to consume approximately 1.5 liters of fluid for each kilogram of body weight that you've lost. So going back to ways to prevent fractures and injuries, you want to eliminate your distractions. It's the big thing. Keep your eyes on the trail, alternating between looking right in front of your front tire and 6 to 10 feet ahead of you. Something I've always taught and that has worked really well for me is to look through the curve ahead of you. So Don't always keep your eyes straight down in front of you, but instead kind of look through the curve, and that will really help your performance. If there's something of interest, stop your bike by all means. Take a look, take a picture, take a selfie, then get back on your bike and keep riding. Instead of looking off, at the lake on your right, wherever your head goes or your eyes go, your bike is going to follow. So the last thing you want to do is crash because you're looking off to the side. Some very basic things, but sometimes, we get caught up and we don't think about these very simple things to do to keep us safe and, able to train hard on our bikes. So moving forward, ride within your limits. Overriding or riding above your ability level can significantly increase risk of injury. All right, so check your trail maps ahead of time to determine the difficulty of the trail. The majority of the trails now have been ridden by a lot of people, and there are maps available to let you know what level the trail is. So, for example, on the right-hand side, there's a nice graph. Green is probably the easiest trail, moving all the way to blue, black, and double black. They're rated very similarly to ski slopes, so that can also kind of guide you as well. And then going back, maintain control of your bike at all times when trying new trails. Don't override. Try to be careful. Ride it slow the first time, then you can go back and ride it faster later on. So the number 3 most common injuries, head injuries. Unfortunately, we don't want this to happen to us. In the picture, the guy's not even wearing a helmet. So rule number 1, wear your helmet. Going over handlebars is more common versus like falling off the side of your bike and getting like a lower leg injury. Unfortunately, females tend to be more seriously injured than males, and it's because they're more lighter weight, and it's more easy for them to fall over their handlebars. Although the most injuries are typically sustained by males, ranging in the age of 20 to 39. We're going to get this word. Got it. All right. So let's talk a little bit about prevention. I've already probably beat a dead horse here, but wear a helmet. Wearing a helmet will not prevent injury, but will help decrease serious injuries. So a recent research study came out that if you wear a helmet, it can reduce your risk of a head injury by 39% and a facial injury by 28%. And there's a wide variety of helmets. Your kid's going to find something that they like that's cool, whether it's the top helmet with kind of a visor on it, or if you're much more into downhill or like the more aggressive mountain biking, the kind that has the facial part that comes around to the front, that's good to prevent like some sort of facial injury. Again, maintain control of your bike and put your body in the correct position. Thank you. So just some general positioning on the bike. You should have your weight on your pedals. Your knees should be slightly bent. Your shoulders should be low with your back kind of level and flat. Your head should be up. Your eyes should be forward. And your elbows should be out and kind of soft. So let's go into a little bit of position. I did bring my mountain bike today so we can kind of go through some positions and I can demo them a little bit on some flat ground, but I can show you the bike position. So we'll kind of go through that now. And as we do that, I'll have Chrissy kind of help me get the camera so we can kind of go through this together. So I brought my mountain bike, Athena, with me today. It'll kind of help us. There we go. Excellent. Cool. So let's talk about downhill position. So once you're on your bike, I think it's very important that you have the correct position. So obviously your feet are going to be on the pedals. The balls of your feet are going to be on the pedals. Your hands are going to be like gently holding onto the handlebars. And as you're going downhill, you really want to shift your weight posteriorly. So a more advanced or technical mountain bike will have a flip switch that you can drop your seat down. And you would want to do that if you are riding some serious downhill. If your seat does not drop down, you want to shift your weight posteriorly behind your bike so that your weight is not forward and you don't go end over end. You also want to have your your hands nice and soft, and you're going to brake more with your back brake and kind of feather your front brake. That's going to be your control. If you hammer your front brake too much, that's another reason you could go over your handlebars. And as you're riding, you want to kind of keep your shoulders down and back and your back flat. So your downhill position, you are going to be behind your bike in this tight position, okay? So let's shift to uphill position. It's almost the opposite. So while you're climbing uphill, you're grueling and you're working really hard, you want to sit towards the front of your seat, but keep your weight on the seat to prevent spinning out. So your butt's going to slide forward, you're going to have your elbows bent and soft, your shoulder is going to be relaxed, your chest is going to be open so you can keep breathing. You're going to lower kind of down your center of gravity so that it's equal between your front and your back tire. So you're climbing uphill, but you also don't want your back tire to spin out. So you're going to be about in this position, chest is open, and you're going to be pedaling here, okay? I think that's about all, at least for now, the bike demos that we have. We'll come back to this in a little bit. Actually, maybe we can just stay right here. This is great.
It's washing it out.
Cool. If you want to adjust, we can. Yeah, that looks great. All right, bear with us as we make a few adjustments here. Thank you. Push me forward. All right. Let's talk a little bit about overuse injuries. For my mountain bikers who are really kind of getting into biking, let's talk about ways that you can prevent overuse injuries. Or if you're feeling these things, let's talk about some exercises, stretches, positional changes that you can make to help reduce these overuse injuries. Wrist, hand numbness and tingling is the most common because you're riding and you're gripping your handlebars really hard. 92% of riders report sensory or motor problems because you're just gripping your handlebars, and there's a lot of vibration that happens, when you're riding. Knee and back pain, 24 to 41% of riders, and back pain, 24 to 41% of riders, and then knee pain is just a little bit less. So let's talk about wrist and hand numbness due to prolonged gripping of the bike. Your hands provide your control over the bike, and they also are absorbing a fair amount of shock. And you have that constant jarring on uneven surfaces. So let's talk about a little bike fit tip that you can use to help if you're having any of these symptoms coming along. You want to make sure that your hands are aligned with your shoulders. So while you're riding your bike, you don't want to have handlebars that are too wide. You also don't want to have handlebars that are too narrow. Your hands should be in line with your acromion or just the middle of your shoulder. And then your wrist should be maintained in neutral. So if I was from the side riding my bike, I would want my wrist to be in a neutral position instead of dropped really far back or rolled really far forward, because both of those positions place an extreme amount of stress on your wrist joint. And you just want to be relaxed and then feathering your brakes. And then always wear gloves to ensure a good grip on your handlebars. Once again, we talked about it in the beginning so that your hands don't slide over and you don't lose contact with your hands. So yeah, the top is a very bad wrist position versus down low. The guy has gloves on and his wrist is in a neutral position as he's riding. Let's move to low back pain. So low back pain tends to be due to the increased demand on your back and the trunk, as the rider tends to maintain balance while negotiating rough terrain. So that static forward flex position will increase your back pain, and also tight hips can increase your back pain as well. So while you're riding, your back is very forward flexed. It's hard to keep your trunk up and neutral. So your back just gets tired in that forward flex position for a long time. Good, perfect. So there's a picture of a road biker, but it's the same for both road and mountain bikers. You want to keep that pelvis nice and level because pelvic misalignment or malalignment can cause a lot of back pain. As you're cycling, you don't want one hip to drop and then the other hip to drop because the side that's up is pinching your back, and the side that's open is like stretching everything. So you're going from one side to the other, getting pinch, stretch, pinch, stretch. Your hips need to be level on your bike. That's very important. You shouldn't be dropping side to side. You need to use your core and abdominal muscles to stabilize your hips and your pelvis. And like I said before, no rocking with each pedal stroke. So let's go to another bike fit tip that you can use to help improve your back pain. So the first thing you want to do is check the reach of your arms to the handlebars. And this might be a good time for me to get on my bike and give you guys a little fit tip. And I'll get on my bike and let's make sure I'm in the right position. So here, perfect. Okay, so I'm going to hop on my bike here. And my elbows, I should be able to reach my handlebars without having to like overreach too far, and then I get a forward flex back. But I also shouldn't be so close that my elbows are super bent. I should have a nice soft elbow position here so that I'm not locked out or rounded, but I'm also not reaching. So here I'm nice and bent. My spine should be at neutral, and I should be able to hinge at my hips versus being roundy. Another option, if if that still doesn't alleviate your back pain, you can change out this stem piece to elongate your bike a little bit more or shorten it up. And then you can also adjust this back piece on your bike here. It takes a couple of tools, and if you don't feel comfortable, by all means, take it to your local bike shop. But if you want a little do-it-yourself, you can adjust these two pieces on your bike independently to make sure that you have that nice soft elbow and that nice flat back while you're riding. So those are little tips to help, if you have some back pain. All right, so now what do you do if you have back pain? The number one thing is we need to train our core, or also known as our abdominal and our spinal muscles. We need to find that spinal neutral. Spinal neutral is not super forward and roundy, but it's also not super hyperextended. It's a nice, flat, soft back. We need to work on the stability and endurance of our core and trunk. Because as you're riding, you're never still. Your body is shifting side to side. So you need to have some stability and endurance. It's an endurance-based sport. And then going forward, adding instability components to mimic the changing terrain that you're going to experience while you're out mountain biking. Let's go into some exercises and some ideas. So we're going to go into some basic core and trunk training. Some ideas are listed here on the bottom. A front plank, maintaining that neutral spine, getting those tummy muscles going. A side plank, working on the side obliques, getting the shoulders in a nice stable position. And then also, the far right picture, I think, is one of my favorites for mountain bikers. It's called the Quadruped Rib Dog. Quadruped just means on your hands and knees. And bird dog, it's named after, an old hunting dog that points their nose in one direction and the tail goes in the opposite. So you would mimic that. Your arm is going to reach out in front, your leg is going to reach back while maintaining a neutral spine. But it allows for a little slight amount of extension to counteract all that flexion that you've been doing on your bike. And then it also challenges your pelvic control. As you're moving one arm, while you're biking, your arms are moving. While you're biking, you're pedaling. So it really is a nice exercise to work on stabilizing your trunk and your pelvis while your arms and your legs are doing something. So let's move into some advanced core and trunk strengthening. We're moved past the basic stability holds into some more advanced positions that kind of mimic being on the bike. So if you're in a push-up or a quadruped position, that's a great way to train because you move this position down onto the floor. So you're in that kind of quadruped position on your bike as well. You're going to add some upper body training. In the second picture, the gentleman is kneeling and then rolling out and controlling his core and abdomen so that his back doesn't hyperextend. And he's also maintaining control of his arms. Adding a ball causes your trunk and your core muscles to work more dynamically to stabilize your body. Okay, that's another component. If you have a yoga ball at home, you can start working on some of these things. The second photo is of the same gentleman crawling out over the yoga ball and drawing his knees in to work on the abs. Or also, conversely, for my really advanced athletes out there, you can really get on that yoga ball and maintain one leg and then lift the other one behind you to really get that nice glute activation and really challenge your core. Now, if you're interested in any of these exercises, we'd love to help you with our athlete development program, or you can also reach out to me at the end of this webinar. So let's move on to the final overuse injury that we see a lot. Commonly, the knee pain happens in the anterior, the front, or the side of or outside of your knee. 20 to 27% of bikers have reported knee pain. The anterior or front patellofemoral. Patellofemoral is kneecap riding in that femoral root. That pain occurs due to excessive forces on the underside of the kneecap. And typically it's from just the repetitive bend straight, bend straight. People tend to complain of knee pain when they're climbing up a hill, so you're really grinding it out, pedaling in a high gear, so in like your really hard gear, or pedaling at low cadences, so really just grinding hard. You're really putting a lot of stress to the front of that kneecap. Another common area is the lateral knee. It's often associated with iliotibial band syndrome. It's due to that repetitive knee bend when your knee is not in neutral. So if you're riding and your knee is not tracking in the center, or it's tracking outside, that IT band is grinding. Pain and inflammation at the outside of the knee when the IT band fibers slide over the lateral femur tend to be the root of that pain. Okay, so let's go into a little bit of positional things here. Why would your knee hurt if your knee is not tracking in the middle? Possibly your knee is tracking to the outside, or it's tracking inward. You can see on the pictures in the bottom, you can see that that gentleman's knee on the viewer's left is tracking way to the outside. That would probably cause some of that iliotibial band syndrome, versus the far right. Their knee is tracking a lot inward. That would lead to a lot of medial or inner knee pain. Typically, the reasoning for either the turn out or the turn in tends to be poor hip strength. You have strong sagittal plane, which is the front plane here when you're biking. You do that all the time, bend straight, bend straight. We have the really weak frontal plane musculature where that knee goes in and out. So we need to work on getting those hips a lot stronger. Another reason is pedaling in a higher than necessary gear. So you're really pedaling in what we would call a low gear and just spinning out versus working hard on being efficient with your gear changes as you're going up and down hill so that you're not putting excess wear and tear and grind on your kneecap. So let's move to another bike fit tip that can help reduce some knee pain. So number one, you want to check your position while you're on the bike. Okay, look down while you're riding. Look down at your knee and see where is it tracking at? Is it out? Is it in? Or is it right in the middle? Your knee should be slightly flexed at the bottom of the strip. So when your foot is all the way down, your foot should be flat and your knee should be slightly bent. However, your knee can straighten and your heel can drop, but when your foot is level, your knee should be slightly bent. Your knee should be facing forward during the flexion or the bending portion of the pedal stroke, and your foot should also be facing forward. That may require cleat or pedal adjustments. And we'll go quickly into some pedals, which is the next slide. And if you have just a plain flat platform pedal, you would not need to do any adjustments other than to turn your foot straight ahead and make sure that you're riding with your foot facing straight ahead. And typically, the flat platform pedals are for my beginner riders. It's really easy to get on and off and dismount. Just wear some tennis shoes and pop on your bike and go. Cage pedals are, for my more intermediate riders. You slide your foot in, and then you also don't have to make a lot of adjustments either there. Just make sure your toe is facing straight forward. There's not a lot of room for error there. Clipless pedals, the bottom photo on the right-hand side, is for more advanced riders. It also involves learning how to get in and out of the pedals, how to clip out and flip that heel out to the side. And that's where a lot of adjustments can occur at, because you may have put your pedals on and your toe might be turned in a little bit. So we need to adjust that pedal and the bottom piece of your shoe to make sure that your toe is facing straight ahead as you're going through your cadence. There are multiple pedal types. It really just depends on what your experience level is and how comfortable you are getting on and off the bike. So a couple exercises that are some of my really favorite bread and butter exercises that I still do on a regular basis, and I encourage all my patients to do if you have knee pain. The single leg bridge is a great one. It encourages that glute and posterior chain activation while also stretching out the front of your hip. You know, we're working on opening up. We're up on the bike a lot, so you get that forward flex position, and that single leg bridge really pushes you out of that flex position and activates your glute. Clamshells are great as well, because as you can see in the picture, her knees are nice and neutral, and using a band to help push those knees out to the side is excellent as well. Gives you that little extra resistance and reminds your knees of where they're supposed to be. So double leg squat and single leg squat, I like both of these because a double leg squat, you can see her position in a double leg squat is very similar to being on a bike. And if you're just riding and going, you know, not pedaling, that's about what your double leg squat looks like. You know, one foot might be slightly forward from the other, but your double leg squat should be in that position. Knees are nice and bent, back is flat, and you're holding onto your handlebars. Now I also put some suggestions for sets and repetitions. I included 3 rounds of 30-second holds, because when you're biking, you're in a static squat hold position. So you need to build up those muscles to help maintain good knee alignment with an emphasis on endurance. I had a single leg squat in here as well, because there are times when you're shifting your weight from one side of your bike to the other, and this also really helps you look at alignment. Is my knee tracking correctly when I'm doing a single leg squat? If not, it's probably not tracking correctly while you're riding your bike. Let's move into a little bit of flexibility drills that can really help decrease your risk of injury while you're on the bike. So before you hop on your bike, even like at the trailhead parking lot, it's okay to do a little bit of warm-up dynamic movements and stretching to get the blood flow going. You know, it only takes 10 to 15 yards, you know, less than 5 minutes, just to do some knee hooks down, some high knees back, quad stretch down, some butt kickers back, some hip flexor stretch with, you know, that reach over so that you're really stretching out the front of your hip flexor before you get on the bike. And then doing like a lunge with a twist. Open up that thoracic spine a little bit before you get on the bike. Do some hamstring rock backs, do some Frankenstein walks, and then also, you know, get a little groin stretch in there with a side shuffle. You know, within 5 minutes, your heart rate is up, your blood flow is going, and your muscles are ready to work. You know, for those, if you may want to foam roll before you leave the house. That might be a good option too, because you probably don't want to bring your foam roller to the trailhead. But foam rolling is a very, very important part of maintaining your flexibility, especially of those tight, painful muscle groups. You know, your quads are really tired and tight after riding. Your glutes might be really tired and tight after riding. So getting on the foam roller and working the quads, the IT band on the side, and the hamstrings can really help with the management of knee pain or even some back pain as well. So you're done with your ride, and you need to do a little bit of static stretching. Now that you're done, your body's cooling down. Now's the opportunity to statically stretch. That means holding the stretch for 30 seconds or more. You can do a glute stretch to stretch out those hip muscles after riding on the bike, and stretch out your calves as well, because they're working really hard on the bike. There's a lot of push-pull that happens in your calves that you need to stretch them out at the end. And the next slide is one of my favorites, because it shows you how to stretch your quads and your hip flexors. And being in that forward flex position on the bike for an extended period of time, these muscles get super tight and locked up. So we need to grab a hold of your bike and spend a minute stretching out the front of your hip. You can also, if you need a little bit of balance, get in that hip flexor stretch and stretch out the front of your hips as well. And you can use your bike to help you go through a lot of these stretches. Let's go into a little bit of foam roller flexibility for your back. And I put this specifically post-ride because it works on extending your upper back a little bit. Because when you're riding your bike for a long time, you're forward flex. We really want to counteract that forward flex position by working on our mid-back extension and getting our posture back, because we're going to lose it while we're on the bike. Even the best riders come back and they're pretty forward flexed. So if we can counteract that by rolling on our mid-back, then we'll really improve our posture and decrease our pain. So going back, stretch with your bike. You can do the quad stretch. You can even stretch your hamstrings on your back using your bike. And it's cool. So lastly, let's kind of put it all together. I think that safety is the most important thing. If you want to keep riding, you have to be safe. We talked a lot about the different ways to be safe. Riding your bike with a helmet, getting some correct safety gear. It's a good investment, and it's worth it. Riding within your means, making sure that your bike is under control. And then moving to maintaining your body. You know, this is the body you have that you choose to ride on the bike. So if you don't take care of it, you're not going to be able to ride your bike because you're going to be in too much pain. So make sure you take care of your body to improve your performance on the trails. Make sure you keep adequate hydration with you while you're riding. And make sure if you will pre, mid, and post-ride to make sure that you are able to perform at your highest level. And then finally, you know, if you're having some pain or something just doesn't feel right when you're on the bike, check your bike fit and your position prior to your next ride. I challenge everyone who has a mountain bike or you're going to get one, go out in your garage and check your bike. Make sure that you have the right fit so you're not going out there and exposing yourself to the possibility of having a knee injury. So most of all, have fun. Biking is a great sport. I love that kids are starting to get into it at an earlier age, and it's just a way to adventure and get exercise at the same time. So at this point, is there any questions from our virtual audience? All right, so if there's any questions or concerns for my audience out there, you can get a hold of me. My email is listed here, jbasil@mail.show.org, or you can contact me at the Walnut Creek Clinic, 925-979-3430. Those are both great ways to get a hold of me. I'd love to field any questions, concerns, or, you know, if you're a cyclist and you're interested in more information or training, or you have an injury, please get in touch with us. We would love to work with you.